Good afternoon and welcome to our latest edition of Living Well with Adena. My name is Dr. John Gabus. I'm the Medical Director of Community Partnerships. And today we're going to be talking about ADHD and the stigma surrounding that and ways that you as parents and adults can help treat those and provide structure for those with ADHD. But first, our dear friend COVID is back and it's resurging now. And I wanted to remind our viewers, please, if you haven't been vaccinated, you can go to the Ross County Health Department. You can go to your primary care provider. You can also go to local pharmacies who are stocking and carrying the COVID vaccine. Even though the Delta variant is surging, getting a vaccine does help protect you against being hospitalized and, most importantly, from dying from COVID. So we strongly encourage you to get vaccinated if you haven't done so already. And I know that ADHD is a very important topic for parents. If you have any questions, please put them in the chat box or the comment section, and we'll get to those as they come in. Thanks for tuning in. With us today is Dr. Elizabeth Cordial. Dr. Cordial is the Associate Program Director for the Family Medicine Residency Program here at Adena Regional Medical Center. And why don't you tell us a little bit about your path to medicine?
Yeah, so like Dr. Gabus said, I am a family medicine physician. I practice out of the Adena Circleville office, which is actually my hometown. So I'm very happy to be serving in my hometown where I grew up. I went to undergraduate and medical school at Wright State in Dayton, Ohio, and then I did my residency in West Virginia at Marshall University. I've been back with Adena since I graduated from residency for about 4 years and working with the residents for about 3 of those 4.
That's terrific. So. That's great. Working with young physicians certainly is a joy, and it keeps you on your toes, doesn't it?
It definitely does.
Oh, good. So let's get right into it. So, Dr. Cordial, in your practice, you see children, and I'm sure that in the children that you see, you have diagnosed ADD or ADHD. First off, can you talk about this common neurodevelopmental issue and what's the difference between ADD and ADHD?
Yeah. So ADD is something that I see routinely. It's very prevalent among both my pediatric and my adult patients. There are multiple symptoms that are included in the diagnosis of ADD or ADHD, including both behavioral and focus issues. So there's hyperactivity, which gives you the H in ADHD. There's disorganized thoughts, disorganization in general. A lot of our patients have difficulty in school, forgetfulness, things like that. And so the difference between ADD and ADHD is that H component or that hyperactivity. Patients who are considered to have ADHD do have the hyperactivity component, the impulsivity, that patients who have ADD without the H, they're more the lack of focus, forgetfulness, disorganized. And then there's a combined type. So you have ADHD, hyperactive type, ADHD, or ADD, inattentive type, which is the focus issues, and then the combined type, which are our patients that have all of those in some level or another.
Mm-hmm. So this is I know this is a chronic brain situation, status, developmental delay, if we want to call it that. How do most parents present their children to you whenever they have a suspicion or something?
Right.
Just, they're frustrated. Can you step us through that first visit and then maybe what evaluations occur?
Right. So absolutely. So obviously every patient is a little bit different. Every situation's a little bit different. ADD versus ADHD do present differently. But a lot of times it starts with that classic, they're having trouble in school. There may be some concern for behavioral or conduct type disorders, that they have trouble sitting still. They talk and bother their neighbors in class all the time. And they're typically those little chatterboxes that never get any of their homework done. That's not to saying that's everyone, but that's normally what it brings to our attention is those first few years of school and starting to struggle a little bit. Sometimes it's the parents that bring it up. A lot of times it's the teachers that'll bring it up in a parent-teacher conference. So the first step is always getting a really good history of the symptoms. What's the child like at home? What's the child like at school? Where are we noticing these behavioral patterns? Where are we noticing this lack of organization? Is there something else that could be causing the behavioral issues that's not maybe ADHD?
That's a good point.
So ADHD can definitely be confused or mixed up with other disorders such as anxiety, some oppositional defiant disorder, just a hyper kid that needs to get a little more exercise when he gets home at the end of the day before he does homework, things like that. And so we definitely want to make sure that we're addressing things with both the teachers and the parents. And one of my first steps that I always use is a Vanderbilt scale. So we ask the parents to take these forms to the teachers and themselves and fill them out so that we can see across multiple settings how the child is doing.
So that's an important thing to evaluate across multiple settings.
Absolutely.
Because the children are not always at home all the time. And with school starting, the timing was great. Mm-hmm. With school starting, that environment's going to be critically important. We won't talk about the impact of distance learning on ADHD, but I'm sure it had an impact. So as we're going forward with in-person, likely classroom settings, we talk about the environment. And one of the components in a classroom is you have to have order. You have to be orderly. You have to have a routine. And I imagine for some of these kids, that doesn't go well.
Right, absolutely. That's one of the hallmarks of ADD is that disorganized thought processes or disorganized patterns. So they actually do better with structured environments, but they also are disruptive to structured environments. So if you have a class of 15 kids and 5 of them want to be disorganized, it can be a little difficult for teachers. It's also frequently a new environment. And when you're someone who thrives on chaos, even going into a new structured environment, it's still a difficult transition. And that's why we catch it a lot of times in those young school-age children who are, for the first time, being forced to be in an organized environment where they have to sit still and focus on things. Mm-hmm. So that's why that's a very difficult transition for them and why we usually diagnose it then.
Mm-hmm. So with parenting mm-hmm. and creating an environment that's supportive for a child with ADD or ADHD, what would that look like, say, after school for homework or structuring of their day at home? What would be an example of a good way to approach that?
Right. It's the best thing to do is individualize it to the child and their strengths and weaknesses. I always give my parents the advice of letting them have a set time period to kind of get all the wiggles out. So have a little bit of time right after school. They've just been sitting for 6 hours. They don't want to sit for another 2 to do homework. So give them that time to, get the wiggles out, do some physical activity, do some exercise. We're always pushing that with our kids anyway. And then bringing them back and setting them down, having a set time, a structured environment, setting expectations and pushing them to meet those expectations. In a supportive way. And that's kind of the most important thing for the behavioral is keeping the expectations the same.
That's great. I imagine consistency, raising children, consistency is one of the most important components.
Absolutely.
Of discipline, not just punitive discipline, but establishing the patterns that are healthy for the rest of their life. Mm-hmm. I imagine parents get very frustrated whenever their kids take 2 hours to do 10 math problems. What type of advice do you give to parents whenever they say, Tommy it just drives me crazy. He just won't finish his homework.
Right.
What kind of advice do you give to the parents?
A lot of times it's just support. It's letting the parents know that they're not alone in this, letting the parents know that this can be a variant of normal, and sympathizing. It is a struggle. It is difficult. There's so much more fun things you can do as a family if they would just get those homework done in 30 minutes instead of 2 hours. but giving our kids a little bit of grace, meeting them where they are, and keeping that structured environment so that they can have that expectation. If you get the homework done, then we do the fun things, or then we have our family time, but we really need to stay in focus. And that can be so difficult and so overwhelming. But it is definitely an important part of keeping that pattern and that structure and that consistency throughout every day.
That's very, very important. As a parent, I've known that consistency is the best way to go. So one of the leadoff comments that we had was stigma about ADHD and ADD. So I think there are multiple areas where stigma comes into play, and that's how you respond to your child whenever they're willful and they get you frustrated.
Right.
Another component is when teachers say, "Oh, that kid has ADHD," and it changes their outlook or how they approach them. Can you talk a bit about how you see that stigma playing out negatively for kids as well as families?
Yeah, absolutely. It is a very difficult stigma to overcome. Mental health in general, and especially ADHD. We've got so many people in the community that say, "Oh, that was never around," or "they just need more discipline," or "they just need some, their behind's busted," or things like that. And, everybody has their own way of handling things, but when it comes to those negative feelings and those negative stigma, it does negatively impact the kids. They hear people being disappointed in them. They hear people not expecting things out of them because they have ADHD, when that's just not the case at all. Our patients, children and adults who have ADHD can be just as successful as patients who don't. They can be just as disciplined as patients who don't. It just takes a little bit more of a coping mechanism, a little more learned behaviors to handle the feelings that they have and the disorganized thinking that they have. But a lot of very successful people, a lot of very creative people are patients who have ADD or ADHD and have learned to cope and to continue to thrive in environments with those coping mechanisms. So I think fighting that negative stigma and being an advocate for our patients and saying, no, we're not going to say that this patient can just fail or can just skate by on the coattails because we just want them to get C's so that they can get through because they have ADHD. Having expectations that they do their best, and their best may be C's, but their best could very well be straight A's and go on to do wonderful things. And we don't want to curtail that just because they have ADHD.
Sure, because kids will live up to the expectations, high or low.
Exactly.
Yep. Okay. And we're going to talk a little bit about treatment, but I want to be sure that we cover some things that could be misinterpreted as ADD or ADHD. Do you have an idea about what some of those things might be?
Yeah, so absolutely. So we've mentioned a couple already. Oppositional, defiant, and conduct disorder are things that the patients with those diagnoses are a little bit more willful, and those can often get misdiagnosed as ADHD. Anxiety is a big problem, and it usually is comorbid or happens with ADHD. So then you have to learn to tease out what's the anxiety versus what's the ADD and treat both. Another one is sleep disorders. If a patient's not getting enough sleep, then they'll be a little more willful, a little more defiant, a little more disorganized in their thoughts just because they're not getting enough sleep. So getting a good solid night's sleep and quality sleep can turn that around without anything else. And then you also have your patients that are just bored in school. They do great at home. They're perfect at home. They're wonderful. But at school, and they have to sit there and they already know everything because they're, the gifted and talented kids. Or they're the kids that don't really like school. They excel at other things. And so you get those kids who it might just be that.
Mm-hmm.
And so
it was interesting that you brought up the creativity component. I had a patient many years back who was very creative, very artistic, very visual, but also very disorganized, and had a hard time accomplishing tasks in an efficient way. And we talked about with her parents getting her on some medicine, and the medicine helped her focus, but she said, I lost my creativity. So for some kids, that's just who they are. And, there are those who work with the opposite side of the brain, the more artistic versus the analytic.
Mm-hmm.
And sometimes kids that's just them. And treating them may minimize or mask that creativity. So we've talked a lot about what ADD is, ADHD is. Remember, if you have questions, please put them in the chat, and we'll get to those if they come in. So now let's take a step towards how do we treat ADD and ADHD?
Absolutely. So, like I said, the first step is always evaluating where we're at with the patients and what they have. So, we do that. Like I said, my personal preference is the Vanderbilt forms. So, once you have a good diagnosis and you know what the patient's problem areas are, because there are multiple symptoms they could have, and they could have 1, 2, or 7 of the symptoms, and what those problem areas are, you focus on those. Primarily, we do have a lot of behavioral or coping mechanism teaching that we can do. So we've mentioned some things like having a good structure in the home, having a good structure at school, teaching these behaviors to try and do behavioral modification first, and seeing if we can teach our patients to have these coping mechanisms and to be able to deal with the feelings that they have or the disorganization that they have before we try medications. If that
So an example of one of those that I'm thinking, if I were a parent listening to saying structure, what I'm imagining kids sitting at the dining room table, and their homework's in front of them, but the other kids are running around, the dog's barking, and the TV's on, and they're trying to get dinner.
Right.
So I would think that would not be conducive.
Right. So definitely with these kiddos, they have disorganized thoughts. They're going to thrive on chaos. So we need to minimize the chaos as much as possible. That's why I always recommend having that 30 to 45 minutes of downtime when they get home. Let them run around like crazy. Let them get the wiggles out, and then find them a nice quiet corner, without the pets, without the siblings, with a parent readily available, but maybe not hovering right over them, to focus on getting their homework done and that quiet environment. A lot of patients do better in their bedroom. Some of them, there's too many toys and too many video games in the bedroom, so they have to be at the dining room table or somewhere, some small corner of the home where there's not as much stimulation, so only stimulation they have is to get their homework done.
Good. That's good practical advice. Because sometimes we hear what we're saying, but our patients don't know how to put that into action.
Right.
So I think that was some great advice. So now on to medicines, because I know that keeping the environment predictable, consistent,
right,
quieter, it works for some, but it doesn't work for everybody.
Right.
So how do you decide when to start a medicine?
Right. So that's always a conversation between the provider, the parents, and the patient. And I always include even my school age patients in the discussion of how are you feeling? What do you think is going on? How do you feel about taking a medication? I definitely think when there's school involved and there's failing of classes, when we've tried the behavioral modifications or the structure and the quiet, consistent environment, and those things have all just not worked, then it's time that we at least start the conversation about medications. Some parents choose to do medications right away, and that's a fine choice. Some parents choose to continue and to wait and to try other things, and that's also a good choice. It's all about what works best for our patient and their family and their environment. But when we do start with medications, we do have a variety of options. The one that everybody has heard of or everybody knows about is either Concerta or Adderall. So these are stimulants. Concerta is methylphenidate, and Adderall is another type of methamphetamine medication, which is not to be confused with the street drug. And so they are stimulants. They do work very, very well. They're the most researched medication for ADHD. There is some slight concern for addictive potential, but not in the way that we use them, and not when they're prescribed and taken appropriately. There are some side effects, like some difficulty sleeping at night. And remember, I already said sleep is very, very important. So timing the medication so that patients still are able to get a good night's sleep is important. They are shorter. Some of them are shorter acting medications, so it may require taking medication while at school. So having those parameters set up with teachers to, they need to have this dose at lunchtime or something like that can sometimes be a little bit difficult, but most schools are well aware of the concern and are able to provide that for the patients. So we do those medications. The other is decreased appetite. So we always want for the stimulants. So we always want to make sure that we're keeping an eye on that, making sure the patients are still growing the way they should, gaining weight the way they should. And if they're starting to fall off on that, then we need to encourage their appetite or maybe decrease the dose a little bit. There's also non-stimulant options, things like Strattera or atomoxetine or Wellbutrin, and those can work very, very, very well for patients, and we can see those work. I frequently use those in a little bit older patients because they haven't been as well studied in the younger patients, but they are options that we have, and they less side effect profile, but they still have their own side effects. So. But we do have options, and we do have a variety.
Okay. So do you repeat the Vanderbilt scale after a child has been on medicine? Does that give you a better objective way of saying, you know what, here's where you were before, here's where you're at now, and the only difference is you're taking a medicine? So do you find that helpful?
Absolutely. I do it. I actually do it after any modifications, whether it's medication or behavioral. We'll start out, we'll have the original set, then we'll have a set a few months later to see how things are progressing. And then if we decide to add a medication at any time, then we'll do it after a few weeks of the medication, just to show, it might still feel a little daunting. You might still not be that perfect behavior, but we have seen improvement, and it's encouraging when we do see improvement for the parents and the patients to know I am changing for the better. It's just taking a little time.
I imagine it. If a child has ADHD and ADD, but more ADHD, that impacts the relationships in the family. If all the attention is spent on one child who is the chaos lover, chaos creator, maybe, how do you address that in families whenever this child is getting the bulk of the attention when the other kids, they need attention also?
Right. And that can be a parent's worst nightmare, is to feel like they're not balancing their kids or not being fair to their children. Definitely, I always suggest having family nights or family time. So time when that chaos creator can feel that they're part of the family, whether that's doing something that helps them thrive in a chaotic environment, like a fun family activity that they can just go crazy, or family night board games. That's always a good time to make sure the whole family is bonding. And then also making sure the parents are spending time with the siblings, having a mom-daughter night when the son is the one that they spend the most time with, or having a mother-son date if it's the daughter that's the most time with. But having those set times where you do take a step back from the chaos creator and spend some time with the other siblings, so that they know, I haven't forgot about you. You're still special too. So that doesn't breed resentment. There could be resentment from the chaos creator too, because they're like, why are you paying so much attention to me? Go away, quit yelling at me, and go yell at my siblings. So there's definitely, finding that balance can be difficult, but it's definitely important.
Yeah. And you don't have to be perfect out of the
No.
gate. You just have to know that you want to try to improve the performance of your child and their behavior.
Right.
So we've kind of danced around older kids. Now let's just jump right into adults with ADD or ADHD. I know that in my reading, 1/3 to 2/3 of children with ADD or ADHD, that carries over into adulthood. So if you have an adult coming into you that says, I just can't get my work done, or it's hard to concentrate, how do you approach the adult compared to the child?
Right, absolutely. So the first steps are very similar for me, because a lot of times we're still in a day and age where ADD is a relatively new diagnosis, or there was a lot of stigma even when I was in school. And so people my age may have it and not have been diagnosed because their parents were like, oh, I don't want to be the parent that has the kid with ADD. So a lot of times I will delve as much as I can, or as much as they can remember, into their history of their school times. Were there times when you struggled to keep up, or where you turned in assignments late? What did your book bag look like when you were in school? Or what did your bedroom look like? How much was under the bed, just shoved under there? And kind of get an idea of, is this something that was present in childhood and just missed? Some of my patients will come to me and say, you know what, I thought things got better. I graduated high school, I was working a job, I was doing great, but now I'm in a management position and it takes more focus. And so those symptoms are back. So everybody's history is a little bit different. Some of my patients know they had ADD when they were younger, but they got in a situation where the medication or the treatment wasn't as necessary. But then they got into a new situation or a new environment where they need to focus more. They need to be more on task. Or like your patient, they went from a creative field where they could be all over the place to a field where they needed to be a little more disciplined. And so always getting that history of those symptoms is the first step, trying to find patterns that this has been a lifelong, because it's almost always a lifelong pattern. We rarely ever see it just suddenly happen out of the blue in adults. There's always some clue from when they were kids that told us they had it. And then I walk them through some of the same steps. How much is this affecting your day-to-day life? Obviously somewhat, because you brought it up to me. But is it something that we can have you making lists and having an agenda or a to-do list and get through it that way? Or is this something where we need to consider medication? And the medications are very much the same. So once again, you have the stimulants versus the non-stimulants. And we just kind of walk through. There aren't really Vanderbilts for adults. There is an adult self-report scale that I do use a lot, but a lot of times with the adults, I do more the history and getting a good idea of the symptoms, whether they're affecting them at home, at work environments, if they're going back to school in a college environment. There's always going to be a setting that's probably worse, but if you talk long enough, you'll find out that even the home can be affected in ways as well.
I know I have adults that have ADD, and the pandemic and them working from home had been a difficult shift. And one of the things that I've done is to tell them, when you're working, dress for work. And if you have a name badge, put your name badge on. If there's a uniform that you wear at work, put your uniform on. And that helps you say, I'm at work, and it helps your families say, I can't go in and disrupt that day. So we've covered a lot of territory, and your advice has been very helpful for our viewers. I know that in some cases, the medicines can be addicting, but if monitored and managed and used as directed, it's not an issue. I do know that some folks divert their kids' stimulant medicine. Do you ever have a problem with that, and how do you monitor that?
Yeah, so that has fortunately only been a problem with me a handful of times. Most of the time, the parents are concerned about their children, and that's what it's for. But there are times when that happens. So we do have, controlled substance agreements like we do for anything with our stimulants. And we do have them come in for pill counts. So we always recommend that you bring your stimulant medication with you for your appointment so we can count, make sure the appropriate number of pills are left. We do urine drug screens, especially on some of our older kids. Some of our younger kids, it's a little harder, but we do that to make sure that we find the medication in the kid's system. Just if we get reports, we address them directly with the parent. So if somebody calls in and says, grandma calls in and says, hey, so-and-so is not getting their medication because mom is taking it. And we will address that directly because that affects both mom's health and the child's health. And I think that's a very important thing. So I'm very direct when I talk to my parents about that. And we do have, like I said, the pill counts and the controlled substance agreements like we would with any other patient that has those kind of medications.
Yep. And I think it was important how you started off. It's a small handful, but it's something to be aware of and to be mindful of. Pardon me. So I think we've wrapped up ADD and ADHD.
Yeah.
I want to remind our viewers who are attending the fair next week that Adena Health System and the Ross County Health District will be providing COVID vaccines inside the fairgrounds Monday through Friday, 4 p.m. to 8 p.m. And when you come into the fairgrounds, there should be signs pointing you in the direction of the COVID vaccine site. So please, if you're out at the fair and you haven't gotten to a place to get the vaccine, we're making it convenient for you. And once again, getting vaccinated is the best thing you can do for yourself and for our community. So thank you again for joining us for this edition of Living Well with Adena. And we'll be back in 2 weeks with some other exciting news about Adena Health System. Have a wonderful day.